Hi, it's Mark from TLR. I'm here with Dana Ranahan of Bodyworks Physiotherapy, Sports Physiotherapy in North Vancouver. And we're talking bodies. How you doing, Dana?
Hi, Mark. I'm good, thanks.
So I feel good. Should I stop treatment?
Oh, that's a common question. We hear that often in the clinic. And I think it is a really tricky one because it's hard to decide. People come in with an injury and they're having pain, and maybe they come for one or two treatments and they're feeling a little bit better. And the question is, should they continue with the treatment plan towards full recovery, or are they good enough and should they just leave? So we often get that question, and it can be a difficult one to determine. Often I think sometimes people do leave treatment a little bit too early because they feel pretty good, but they may not quite be 100% recovered, or 90% recovered even, and then they're at risk of re-injuring themselves again if they're not careful.
So what is like a typical injury? Say if I've hurt my back, like what would be the danger if I stop treatment too soon?
Well, if we look at, when you have an injury, there's usually an inflammatory process. Let's say you have a big muscle strain in your back from overdoing it. Well, the muscle has been sort of strained and damaged, and it does take some time to actually heal and build the collagen structure back in the muscle, that it actually has enough tensile strength in the muscle to resist force for whatever it is you want to do. So if you come in with pain, I might be able to loosen things up or free your muscles up a little bit and help you restore some movement, and the pain might start to settle. However, you maybe haven't regained full strength. And if you don't have this full structural healing that's happened yet, then you go to do something again. Maybe you go back to the gym, lift weights, or you're out mountain biking or something and you overdo it, pedaling too hard or whatnot. You could restrain that muscle again, and it might be worse than it was before. So it may take longer to recover. So usually when people come in, if you've hurt your back, I might say it's probably going to be about a 4 to 6 week time frame for recovery. And so I try to give people a framework so they know what to expect. But if you stop at, let's say, 3 weeks because your pain's better, you may be vulnerable to re-aggravating.
And what about if the cause of the pain, the cause of the injury was some other issue in your body that you didn't get to, you didn't address? What about that?
Exactly. That's a good point. And I will say that often we treat, if someone comes in and has an acute back issue, sometimes you treat that area just to settle it down again. But ultimately, we want to get at the mechanics of why you injured it. So, and a lot of times it is whole body. So, if I have like a shoulder issue and I'm dropped on one side, maybe my back's getting jammed on that side because it's tying to my upper back or shoulder. So if we can then get you out of the acute pain and start getting you healing, then we can look at your overall movement strategies and try to help you learn to move a bit better and be stronger, so you're not as vulnerable to re-injure it again. Even if the muscles have healed in the low back, we can improve your mechanics.
So the danger really of quitting early, even though it might seem like, oh, I'm saving money, I think that's maybe a
That's a
secret
big factor for a lot of
reason.
people. Yeah.
The danger is you're probably going to hurt yourself again, and you're going to end up spending more money. Pay me now, pay me later. Is that kind of what
Exactly.
it?
Exactly. And it is tough for some people. Right now, there are some people that aren't working and whatnot, or, reduced hours. And so we have to sort of weigh all that out and determine what people really need. And, if someone doesn't have as much funds, we could talk about that up front and like maybe space out treatments a bit and try to give them a little more in the interim. However, it is nice to carry it out over the whole time frame that we need to really get them to full healing. So those are factors that we would consider when we see someone. But usually it's money well spent, and a lot of people have extended health benefits that can help them afford it. So that's a positive too. And we do a lot of direct billing here for most insurance companies, so that saves people having to deal with it themselves. But it is usually worth putting that little bit extra money into it, and then hopefully you don't recur the injuries and you can get back to all your activities and whatnot without pain. Otherwise, we'll see you again in 6 months or something with another injury, and at the end of the day, it will cost you more.
So if I'm feeling like, geez, I feel pretty good, should I call and just try and see if I can talk to somebody prior to going, you know what, I'm not coming in?
After they've already come for treatment a couple
Yeah.
times, or Yeah, and I think it would be good to talk to the therapist that worked with you if possible, because they will know your situation the best. And, we leave notes in our charts about patients, and so we can share clients sometimes. But if I've treated you specifically, I'll have a better handle on exactly what's happening. So usually it'd be a discussion I would have hopefully before the patient leaves. But if, that gets missed, then yes, definitely you can either call us or email us, and we'll try to have a brief communication about it. And, if it's hard to determine what's happening, we could set a follow-up assessment and just kind of do a reassessment with a view to whether you need to continue or not, if we can't provide enough information on the phone or on email. But sometimes it's hard to tell.
What about a Zoom call? We're still in the pandemic, all that sort of stuff. Do you do any of that?
Exactly. Yes, we do. We offer online telehealth visits. So we can either do a phone consult if someone doesn't have the technology to do Zoom calls, or we can do video calls where you can actually see quite a bit, and people can show us what's hurting and show us where the pain is and talk a little bit about things. We really can actually discern quite a lot from video calls. So I think some people think, you can't put hands on them, or you can't use your acupuncture needles or whatever it is that they've been used to when they come for in-person treatment. But if someone's not able to come related to COVID or work, or their concerns about what's happening currently with the Omicron variant and so on, we definitely can deal with a lot of stuff on video. So it is a good tool to have, and it's built into our software. So it's very easy and user-friendly for everyone.
If you want to get better, you got to finish what you started, basically. So body-works.ca to book your appointment, or you can call at 604-983-6616. Get in, get feeling better, get moving better, get back active out on the ski trails, and of course, finish your treatment. Thanks, Dana.
Thanks, Mark.